does having a double mastectomy always prevent breast cancer recurrence? I will be answering this question in this video, so if you wish to know the research data on this issue, stay tuned. I have discussed the options for the surgical treatment of breast cancer in my other videos. Briefly, they can be divided into two broad categories. The first approach is breast conservation treatment, which involves the removal of the cancer and a rim of uninvolved breast tissue all around the tumor. This operation may also be called lumpectomy, partial mastectomy, or wide excision. Surgery is usually followed by radiotherapy. The other broad category of operations is mastectomy, which involves removing the breast. Women may choose to undergo reconstruction after. In some cases, women may choose to undergo bilateral mastectomy. This is commonly known as double mastectomy. Often, when double mastectomy is performed, one side is done prophylactically. In other words, the breast is removed as a precautionary measure when there is no detectable cancer. If this is the case, such a procedure is termed as contralateral prophylactic mastectomy, or CPM for short. There are many topics pertaining to double mastectomy. In this video, I will address these 5 that are listed here. At the end of the video, I will share the opinion of a panel of experts on the best option for the treatment of early-stage breast cancer. As always, this content is solely for educational purposes and not intended to replace a medical consultation. Please see your doctor for treatment planning. Let's begin with the evidence to show that the proportion of women who elect to undergo mastectomy has increased in certain geographical areas. This is a study conducted by doctors at the MD Anderson Cancer Center in Texas and published in 2025. They found that for women with early-stage breast cancer, mastectomy rates increased from 39.7% to 59.9% from 2005 to 2013. Similarly, in this report published in 2024, it was noted that in Tennessee, the rate of bilateral mastectomy for unilateral breast cancer is increasing. Unilateral breast cancer is cancer occurring in one breast. This team of researchers found that over 20 years, their rate of contralateral prophylactic mastectomy has nearly tripled. I will now look at the reasons patients choose to have double mastectomy even though they are candidates for breast conservation, and there is research data showing no survival advantage for undergoing bilateral mastectomy over unilateral or single-sided mastectomy for women who do not carry high-risk variant genes. Also, a consensus statement was made in 1991 declaring that breast conservation treatment is the preferable surgical option. So, this increase in mastectomy rates is occurring contrary to consensus recommendations. A common reason for undergoing contralateral prophylactic mastectomy is that women feel they do not wish to take any chances with respect to local recurrence and wish to have peace of mind. But does it truly offer peace of mind? This group of researchers found that many young survivors have physical and emotional challenges after surgery for which they may not feel prepared. In addition, is it true that undergoing CPM can prevent recurrence to offer peace of mind? To answer this question, we will first return to the study conducted at MD Anderson. It was found that patients with early-stage breast cancer who underwent total mastectomy with radiotherapy had similar 5-year local recurrence rates compared to patients who underwent breast conservation treatment or total mastectomy without radiotherapy. So, it may not always be true that mastectomy reduces recurrence risk. But does double mastectomy offer total protection from cancer if one or both are done prophylactically? Now, let us review this study published in 2026 to understand the next topic, which is what the estimated recurrence rates after bilateral or double mastectomy are. While more details are discussed in other videos on this channel, in this video, I will focus on the risk of recurrence after double mastectomy and how they are diagnosed. Double mastectomy is often performed in 3 different scenarios when a patient is diagnosed with breast cancer. Firstly, it can be done in the rare instance when cancer is detected in both breasts at the same time. Secondly, cancer in the other breast may be detected sometime after the first diagnosis, and the second mastectomy is done more than a year after the first. Thirdly, women may choose to have prophylactic mastectomy, which is the removal of the uninvolved breast when cancer is detected in one. The risk of locoregional recurrence in this study was reported to be 8.5%, and the research team found that this rate of recurrence is similar to other published reports. We recall that women may choose to undergo prophylactic mastectomy. In this study by a group of doctors at Mayo Clinic, the chance of developing breast cancer after prophylactic mastectomy was found to be about 0.92%. In view of the fact that local recurrence after mastectomy, while uncommon, can happen, it is important to know how it can be detected after double mastectomy. When a bilateral mastectomy is performed without reconstruction, it is evident that a mammogram cannot be performed as compression cannot be achieved for imaging. With reconstruction, the implant or autologous flap can obscure detection of disease. Rather than mammogram, ultrasound examination of the breasts and axilla can contribute to early detection of about 80% of local recurrences, regardless of whether reconstruction was performed or not. For women who have undergone reconstruction, the other imaging modality which may be useful in detecting local recurrence is MRI. Please note that MRI may be less useful for women who have not undergone reconstruction. In this article, the authors recommend implementing postoperative MRI within 2 years of surgery. Women who have mastectomy may therefore be advised to continue regular surveillance imaging, which is no different for women who had breast conservation treatment. The last topic on the list for this video is the recurrence rate after mastectomy compared with breast conservation treatment. We will recall that recurrence for mastectomy performed for cancer was reported to be between 7.7 and 8.5% in the studies we reviewed, while breast cancer occurring after prophylactic mastectomy or mastectomy performed for uninvolved breast tissue was reported to be 0.92%. By way of comparison, this team of doctors from Wisconsin found that local recurrence was approximately 4.6% in their cohort of patients who underwent breast-conserving therapy. It is true that these two patient cohorts were different, but the data appear to corroborate the earlier study by a team of doctors at MD Anderson, which found similar local recurrence rates for breast conservation and mastectomy for women with breast cancer. Here is a summary of the research data reviewed in this video. Firstly, there is an increase in mastectomy and double mastectomy rates for single-sided breast cancer in certain areas. Secondly, patients choose to undergo double mastectomy mainly for peace of mind, even though there is no evidence that it improves survival. Thirdly, local recurrence after mastectomy for breast cancer is reported to be about 8%, while breast cancer occurs in about 0.92% of women who have undergone prophylactic mastectomy. Fourthly, local recurrence after mastectomy can be detected early with ultrasound and MRI surveillance. Fifth, in comparison, loco-regional recurrence for women who undergo breast conservation is reported to be 4.6%. Lastly, to put double or bilateral mastectomy in context, I wish to say that the experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference believe that patients with early breast cancer should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results, among other positive attributes. This is consistent with the data that we have discussed here. Thank you for staying until the end of the video. As always, if you have found the information useful, kindly like, share, comment, and subscribe. Your engagement will help direct further content for my videos in this channel. I hope you will join me in the other videos as well. Until we come together again, take care.